Students, sex, STDs and STIs. Should students be informed? Do the benefits of being informed outweigh the costs? Definitely. Not only should sex education be taught in schools, but it should be implemented as a required course of study. We must bring real sex education back and reject the failed abstinence-only programs. This is the best way to help American teens make smart decisions and healthy choices. It is mandatory for sex education to be implemented to first, help prevent teen pregnancy, 2, inform students about STDs and STIs, and 3rd, instill respect for the subject matter. So why? Help prevent teen pregnancy. According to Planned Parenthood, Fighting for Real Sex Ed and Facts in Brief, Teen Sex and Pregnancy, more than 700,000 teens in the United States will become pregnant this year. This is an exponentially growing problem as 2,800 girls are becoming pregnant every day. The abstinence-only debate, whether or not to teach abstinence-only sex education, is religious in nature and therefore ineffective. Rather, we should encourage students to abstain, but give them information about contraceptives, STDs, preventing HIV. Providing this information doesn't necessarily increase teen sexual activity, and teaching abstinence-only doesn't really make them more likely to abstain. However, when students do stray without this information about birth control, then they are more likely to become pregnant. There are several costs involved. There's cost to themselves. Their education suffers, there's an increase in responsibility, and definitely in financials. There's a huge cost to their child. They're growing up in an unstable environment where they're not receiving the proper time and attention that they deserve. Also, several societal judgments have a huge impact, as well as the media. The movie Juno, for example, glorifies teen pregnancy, and we're seeing it all over our television shows like MTV's Teen Mom. Also, celebrity influences play a huge role. Everyone wants to be just like the celebrities, right? They're popping babies left and right, too. There's widespread talk of sex, and sex sells. It's overtaking our advertising industry and becoming a huge tactic. So why? Help prevent STDs and STIs by informing. Again, according to Planned Parenthood Fighting for Real Sex Ed, 1/2 of all sexually active teens will have an STI by age 25. Also, according to Centers for Disease Control, CDC, and American Social Health Association, ASHA, 19 million new STIs occur every single year. 50% of those happen to us, young people between the ages of 15 and 24, according to teen STD statistics. We have to reduce these statistics through proper education so that we know how to prevent and treat these problems. Why? We have to instill a respect for the matter and have students take this more seriously. According to pros and cons of sex education in school, gender-exclusive classes will definitely have a great impact. When boys are with the boys and girls are with the girls, there's a minimal level of discomfort and discussions will be more effective. Also, we can teach the correct terminology for the reproductive system, STDs, birth contraceptives, rather than having students use street lingo, which can kind of be a little offensive. Also, we're able to address and then reject the myths surrounding sexual intercourse, and if this is all done appropriately, there's a huge impact on preventing sexual problems in adulthood. On the other hand, also according to pros and cons of sex education in school, abstinence only is advocated in some areas and in some schools. People believe that since this is such a touchy subject, it can also result in an out-of-control classroom setting. In addition, there can be a level of embarrassment or discomfort. Religious and moral beliefs can get in the way, and if teachers are trained improperly, they may be biased and add their own beliefs instead of the facts. Despite this, it's still a school's responsibility to teach children and students how to survive, live healthy lives, and how to live in the world they're in. Sex is part of that world. Teen pregnancy is part of that world, and STDs and STIs are part of that world too. Therefore, we must include sex education. It's an individual's and family choice whether or not to enforce or advise this, but it should definitely be here. Sex education is necessary in schools to prevent and reduce teen pregnancy, properly inform about STDs and STIs, and to instill respect for the matter. Therefore, comprehensive, medically accurate, and age-appropriate sex education should most definitely be required in schools. 2/3 of all seniors in high school have had sex. We can't stop what happens behind closed doors, but we can inform students about the door of opportunity for receiving proper sex information. Don't become a statistic. Say yes to sex education.